Hello, today we're going to discuss Chapter 17, starting on page 242 in your textbook. This is a continuation of the discussion of infection prevention and control. Today's topic covers infection prevention and control in the hospital and home setting. After you have completed your reading of Chapter 17 and have previewed this presentation, you'll be able to describe the stages of infection, list two common health care associated infections, and describe 3 ways to decrease the occurrences of each. You'll be able to explain how transmission-based precautions are used with standard precautions, also compare and contrast airborne precautions with droplet precautions, as well as being able to discuss the special requirements for airborne precautions when the patient has pulmonary tuberculosis. In addition to that, you'll be able to compare infection prevention and control procedure appropriate for the hospital with those used in the home. You'll be able to list techniques for handling specimens, disposing of soil linens, trash, and sharps, as well as cleaning equipment in the isolation setting. You'll be able to give 3 examples on how you as a nurse can provide psychosocial care of a patient in isolation. Finally, you'll be able to state the 4 rules of surgical asepsis. You'll gain knowledge that you can apply to the clinical practice setting. You'll be able to use standard precautions when caring for your patient, utilize transmission-based precautions when caring for your patient, properly bag and remove soil linens and trash from an isolated room. You'll be able to teach a patient and the family member on how to properly dispose of soil items in their home. And finally, you'll be able to discuss and teach your patient and or family member proper hand hygiene techniques. I am sure we've all heard the terminology infection. So the goal with this presentation is for you to gain a true understanding of what that terminology means and learn of the stages involved in the infection process. So the infectious process begins with what is called stage 1, the incubation period. So it is during this time that the pathogen or origin actually first enters the individual's body. During this incubation period, this period lasts until the patient or individual starts to develop the onset of symptoms. So the infection can certainly be transmitted during this stage. Stage 2 is called the prodromal period. It is the short term from the onset of the vague, non-specific symptoms to the beginning of specific symptoms of that particular infection. During this phase, an individual can experience symptoms such as malaise or feelings of general discomfort or illness. They may also express to you that they feel fatigued and may present with an elevated temperature. It is during the prodromal period that the individual is considered highly infectious. This is because the microorganisms are more likely to spread during this time. Typically, precautions against spreading the infection are not taken because individuals may not realize they are ill until more symptoms present. Stage 3 is referred to as the illness period. This is when your patient or an individual presents with localized and or systemic symptoms. These symptoms certainly will vary depending on the pathogen and the origin of the infection. So the individual may have fevers, headaches, complain of malaise, or fatigue. Remember that the symptoms will be disease specific and an individual may present with a rise in their white blood count, such as leukocytosis, may even have a rash, some swelling, wound drainage, diarrhea, and or vomiting. The severity of this and duration certainly depends on the pathogen itself and the person's susceptibility. It is during this last stage, stage 4, the convalescent period, when the individual begins to return to what is considered normal state. Symptoms will begin to subside and then for resolve. So what is meant by healthcare associated infections? Those are the type of infections that an individual acquires while in a healthcare setting. Not only does this apply to healthcare workers, but this certainly applies to the patients that we care for in the healthcare setting. Those who are at greater risk for acquiring infections are those patients who have surgical wounds, artificial airways, urinary catheters, IVs, implanted devices, and prosthetic devices. Those who receive repeated injections and venipunctures, as well as the individual who is immunocompromised. As a healthcare provider, you are essential in reducing the risk of infection and the transmission of infection from one patient to the next. You play a critical role in this aspect, and infection prevention and control is not taken lightly. Okay, so infection prevention and control relies on medical and surgical asepsis, standard precautions, and transmission-based precautions. This is to prevent or control the spread of microorganisms. Strict aseptic technique should be performed when performing all diagnostic and therapeutic procedures, especially those procedures involving the insertions of catheters, IV lines, endotracheal and tracheostomy tubes, while caring for individuals with any kind of drainage or wound care. Practicing aseptic techniques will certainly reduce the patient's risk for acquiring an hospital-acquired infection. Isolation is a means of preventing contact between a patient and others to prevent the spread of infections. Emphasis is placed on containing the microorganisms and preventing their spread. Your role as a nurse plays a critical component in reducing the possibilities of your patient acquiring a healthcare acquired associated infection. Your diligence in monitoring your patients at all times for any signs and symptoms of infection will certainly reduce the risk for acquiring an infection. Recognize those individuals that may be at high risk for infections and implement appropriate precautions. Implement procedures to contain microorganisms when an infection is suspected or confirmed. Monitor the diagnostic reports related to infections and ensure that you are using approved sanitation methods at all times. Properly handling and sterilizing or disposing of contaminated items and equipment immediately is another way of reducing the possibility of a patient acquiring a hospital-acquired infection. Remember that our practice as nurses is highly regulated, and we have many standards in which we should follow so that we can deliver effective care to our patients and deliver safe care to our patients and ensure that quality of care is delivered to our patients. The Healthcare Infection Control Practices Advisory Committee of the CDC has actually identified standards for our nursing practice in which we should implement so that way we can reduce the risk of infection for our patients. There are two tiers that we should follow. Tier 1 is standard precautions, and Tier 2 is transmission-based precautions. Standard precautions delineate methods for avoiding direct contact with all body secretions except sweat. Whether or not visible, blood is present. This includes the mucous membranes in all non-intact skin. Transmission-based precautions are based on interrupting the mode of transmission, hence transmission-based precautions, by identifying the specific secretions, body fluids, tissue, or excretions that might be infected. Please refer to box 17.1, Transmission-Based Precaution Requirements, found in your textbook. This is on page 245. Remember that standard precautions is used for all patients. Airborne precautions you would practice when a patient is suspected or has a known serious illness which is transmitted by airborne droplet nuclei. You would use this in addition to standard precautions. This includes patients who may have measles, varicella, or even tuberculosis. You would use droplet precautions as well as in addition to standard precautions if you are caring for a patient who has known or suspected serious illness transmitted by large particle droplets. Examples of these type of illnesses include meningitis, pneumonia, or diphtheria. Finally, contact precautions refers to, in addition to using standard precautions, you would apply contact precautions when you are caring for patients who are known or suspected to have serious illnesses which are easily transmitted by direct contact or by contact with an item in the patient's environment. Examples of these include infections of the GI, skin, wound infections, RSV, or herpes simplex. When you are caring for your patients, you want to ensure that you never touch anything with your bare hands, including body fluids or any surfaces or cavities that contain body fluid. Gloves should be worn at all times if you're coming into contact with body fluids of any sort, including saliva, urine, feces, and blood. The only time you do not apply gloves or wear gloves is for the contact with intact skin or unsoiled articles. So, personal protective equipment, also known as PPE, how do you apply this? You must follow CDC standards in the proper sequence of donning or applying or putting on PPE. Donning starts in the following order. You first put on the gown, followed by the mask or respirator, then the goggles or face shield, and finally the gloves. In removing the PPE, follow the certain sequence. You start with removing the gloves first. Then you remove your face shield or goggles, the gown, and finally the mask. Skill 16.2 in your textbook shows the correct procedure for donning a gown and mask. Skill 17.4 shows the correct procedure for donning and removing sterile gloves. Always perform hand hygiene after removing gloves or a combination of PPE. Let's take everything you've just learned and now apply the nursing process. Remember that this process always begins with assessment and data collection. So when you're looking at your patient, you're going to assess them for signs of infection that may require transmission-based precautions. You want to assess any wounds and make sure that you're assessing wounds each shift for infection. Monitor the patient's temperature and also, upon admission, review labs that may indicate infection. Next step of the nursing process is developing nursing diagnosis related to infection. Always refer to the NANDA regarding this because every individual plan of care and nursing diagnosis is different. Certain infections or diagnoses may include risk for infections related to surgical wounds, open wounds, or weak conditioned, etc. So once you have assessed your patient and developed a nursing diagnosis, now you want to plan your nursing care based on the diagnosis you've developed and what your expected outcome would be. An expected outcome would indicate that you hope that there is no healthcare associated infection acquired during the patient's hospital stay. When using transmission-based precautions that require putting on PPE, you should always prepare yourself before entering into a patient's room. Implementation. Patient teaching is needed on disease process, modes of transmission, and precaution to prevent spread of infection. Standard precautions should be used for each contact with all patients. The most important thing you can do as a nurse is practice hand hygiene. This certainly reduces the possibility of your patient acquiring a healthcare associated infection. Ensure that you follow proper hand hygiene before and after contact with a patient with wound care or invasive procedure. Always follow proper hand hygiene technique as well before donning gloves and after you remove them. The next couple of slides we're going to talk about general guidelines for isolation precautions. Remember that when you are collecting specimens of any type that includes blood, urine, feces, nasal secretions, etc., you always want to wear gloves. When you are collecting specimens, before collecting body fluids or other potentially infectious material, first verify the primary care provider's orders and complete the correct laboratory requisition form. Next, you're going to label the specimen container with the patient's name and medical record number. Also ensure that you follow your organization's requirements and policies regarding labeling. Place the label on the container itself, not the lid, because once the lid is removed, the laboratory specimen may be unlabeled. Don gloves and explain to the patient what is needed. Remember, while you're providing any type of care, and that's especially when you're collecting any type of specimen, you always want to be communicating to your patient throughout the process. Now, collect a specimen without contaminating the outside of the specimen container. Apply the lid, ensuring it is fully tightened. Clean or disinfect containers that are visibly contaminated before placing them in the laboratory transport bag. When you are handling soiled linen, don't take this lightly. Ensure you are practicing proper isolation precautions as well. Soiled linen is handled as little as possible. Roll it up and place it inside the linen hamper in the patient's room. Never carry unbagged soiled linens in the hallway because this can increase the risk for contamination and contaminating the surrounding area. Trash and biohazard waste should be disposed in the proper waste basket. A biohazard bag may be needed. Sharps should never be recapped before disposal, and our sharps are dropped into the sharps container, which are replaced when they are 2/3 full. Clean reusable equipment if it is visibly soiled, and then send it to the central processing department to be disinfected. Always institute measures to protect and enhance your patient's natural body defense. Protect intact skin and mucous membranes, promote a balanced diet and sufficient fluids, provide your patient with the opportunity for adequate sleep, and decrease their stress as much as possible. When a patient has been identified of needing transmission-based precautions, then they should be placed in the proper room. Sometimes individuals may require a private room or can be put in a semi-private room with another patient with a similar infection or organism. When transporting the patient, avoid unless absolutely necessary. If the patient has to be transported, then the patient is given a standard mask to wear outside the room. As a home care nurse, it is important to remember that patients in the home care setting are still at risk for acquiring a hospital-acquired infection. You want to ensure that you educate your patients and their families on ways on reducing the possibility of acquiring infection in the home setting. Please refer to on page 252, box 17.4 in your textbook, Infection Prevention in the Home. Educate patients to keep soiled linens away from others until washed. Educate your patients and family on proper hand hygiene techniques. Teach them on how to disinfect the bathroom with 1 part bleach and 10-part water solution. Wash dishes in scalding water and let it air dry. If you have a patient in a home care setting who uses needles for any sort, maybe they have insulin injections, Lovenox injections, etc., you want to teach your patients on how to dispose those needles. Proper needles handling includes, in the home care setting, making sure that they put the needles in a heavy plastic jug with a secure top. If for any reason the patient has a wound and the patient themselves or the family members are providing the wound care, you want to teach them to use gloves for the wound care, new clean gloves at all times, and you want to teach them on how to remove those soiled gloves. Educate the patients to make sure that their room is cleaned frequently. For patients who are immunocompromised, it is important to ensure that they are in a protective environment. Patients in a special room with their own ventilation system is important. No one with an active infection should be allowed in the patient's room, and always remain aware of your facility's policies and procedures regarding protective isolation and follow them at all times. Psychological aspect of isolation. Remember, we provide holistic care for our patients. So patients who are in isolation may start to feel decreased self-esteem or sensory deprivation. Some signs of this could be boredom, slow thought, disorganized thoughts, excessive sleeping during the day, anxiety, hallucinations, or even panic attacks. Always ensure that you're assessing for these type of signs. Nurses are certainly at risk for acquiring infections. OSHA has set such regulations to help prevent healthcare workers from acquiring or becoming exposed to certain infections of blood-borne pathogens. They have identified that the 3 main modes of occupational exposure to blood-borne pathogens are punctures from wounds from contaminated needles or other sharps, skin contact, as well as mucous membrane contact. Actions to decrease your risk for acquiring infections include good hand hygiene and general medical asepsis techniques, such as applying PPE when necessary. So to prevent infections, you can follow what is called surgical asepsis. This is important to remember because this is different from medical asepsis. Surgical asepsis, the goal is to keep an area free from microorganisms. There are 4 rules of surgical asepsis. You always want to know what is sterile, know what is not sterile, separate sterile from unsterile, and if there is concern for contamination, remedy contamination immediately. Surgical asepsis is practiced in the operating room, obstetric area, and special diagnostic areas, and for procedures such as administering injections, changing wounds, etc. Again, always know what is sterile and what is not sterile, and the goal is to remain free from organisms. So what is the difference between surgical scrub and a regular hand hygiene? There is significant difference here because this type of scrub is more lengthy and vigorous. The goal is to remove as many microorganisms from the skin without damaging the skin. The timing of the hand scrub is based on the time spent scrubbing and not including the rinse time. This technique usually takes 2 to 4 minutes, and a brushless technique can be used with an antimicrobial agent as well. Please refer to your textbook on page pages 256 and 257 and follow the skill 17.1 because this provides you in-depth information and on the technique of surgical scrub. Here we have another technique you have to familiarize yourself with. Please refer to skill 17.3. This is found in your textbook on page 260 and page 261. So when you're opening a sterile technique, you want to remember that you want to start with hand hygiene. You're going to open the package away from the body and only touch the outside wrapper. Do not ever reach across a sterile field and always face that field. Allow at least 6 inches between the body and the sterile field. Remember that any break in the technique of sterilization and handling a sterile package will contaminate the field. Wash your hands before opening the sterile package. Put on sterile gloves before handling the content inside the package, and always check for expiration date. So when you return to the clinical practice setting, you're going to have the opportunity to follow these techniques that we just went over. You have the opportunity to perform surgical aseptic antiseptic techniques, also known as the surgical scrub, and also you'll have the opportunity to hopefully handle opening sterile packages. Okay, so final step of the nursing process is the evaluation. So you're going to evaluate all the care that you provided to your patient. You're going to evaluate the patient's outcome, and you want to evaluate their recovery. Did the patient recover without additional instances of infection? And also assess whether or not the patient's infection has been transmitted to another healthcare worker or another patient in the hospital setting. Great. Now we're going to review the content we just went over. Again, when studying, make sure you review this presentation as well as completing the reading assignment for chapter 17. So let's start with question number 1. During which of the stages of infection would a patient be irritable, fatigued, express malaise, or have an elevated temperature and be considered highly infectious? Is it during the incubation period, the prodromal period, illness period, or convalescent period? When is the individual going to experience these type of symptoms and be considered highly infectious? The answer here is B. Remember, it is during the prodromal period is the onset of vague symptoms, and this is during the period the individual is considered highly infectious. Question 2. So Mary is taking care of a patient with tuberculosis. What specific type of precautions should Mary take? Is it A, standard precautions, B, airborne precautions, C, droplet precautions, or is it D, contact precautions? The answer here is B. In addition to taking and practicing the standard precautions, airborne precautions are used with patients who have tuberculosis because the transmission of the disease is airborne. Question 3. When taking care of a patient with known tuberculosis, the nurse must wear A, sterile gloves, B, sterile gown, C, particulate filter mask, or is it D, shoe covers? Think about this is an airborne infection. So the nurse must wear a mask, right? So the answer here is C. A special mask must be worn when caring for any patients with concerns of airborne transmitted diseases. Okay, everyone, this is our final question. When you're opening a sterile package, you should do all of the following except for what? A. Select a moist tabletop at eye level. B. Wash hands and obtain equipment. C. Open packages away from the body. Or D. Lift the front flap up and toward the body, handling only the outside wrapper. Which one is incorrect? The response here is A. A moist tabletop is considered contaminated. This concludes my presentation on infection prevention and control in the hospital and home. This was a review of the content found in your textbook on Chapter 17, starting on page 242. Please ensure that you read the chapter in its entirety. Thank you.